Hello, good morning. Right, Lorita Anthony from Livala South. Lorita, is the sound clear? Just let me know if you can hear me clearly. Clearly. Grace Sunga, good morning. Yeah, so let us know if the sound is okay. We've had complaints that sometimes our sound is not very good. So please advise if the sound is okay before we get started. I'm waiting for your comment section to tell us if the sound is okay. Lorita Anthony, is the sound okay? Right, the sound is good. Most grateful. Thank you about that. Thank you so much for the feedback. Of course, tell us where you're watching us from. So today's conversation or live discussion is around the subject of lumbar puncture, and it's brought to you courtesy of CarePick Specialist Clinic. CarePick Specialist Clinic is located in Rhodes Park on Omelo Mumba Road. It's a specialist clinic. It's an outpatient clinic and tackles all manner of ailments. And yeah, so we are grateful to CarePick for bringing this topic live to you. And we thank CarePick for sponsoring this discussion. So, we hope that you are drinking water. Ladies and gentlemen, it's hot out there. It's really hot. You don't want to be dehydrated. Drink water and take the water drinking program seriously. Now, also, you've heard that, COVID-19 restrictions have been lifted. Now, that said, you still need to continue protecting yourself. When you're in public, continue wearing a mask, especially if you're not vaccinated. If you are not vaccinated, continue wearing a mask. And if you're not vaccinated, go and get vaccinated. So as we wait, go ahead and tag somebody, share this link as much as you can, because the conversation we're having today is around lumbar puncture, and ask questions. So in the next 15 to 20 minutes, I will be together. Please ask questions, but make sure your questions are around the subject of lumbar puncture so that we can discuss this conversation, or we can have this matter sorted out. First of all, a lot of people are very apprehensive when it comes to lumbar punctures. Most people will tell you that they have witnessed with their own eyes several people have died from lumbar puncture. And they will tell you that their own relatives have died of lumbar puncture. Now, we feel that there's a miscommunication, because if you ask most health workers, they will tell you that they don't see that high number of deaths due to lumbar puncture that people talk about. Most of these statistics that people tend to rely on about deaths due to lumbar puncture, they sound like, when a story is told and it's a grapevine story, it keeps getting distorted as it goes. But at the same time, we will not dispute the fact that there could be some people who could have died of the lumbar puncture. But those are extremely, extremely few. In my own experience, in my own personal experience, I have personally done thousands of lumbar punctures. I have observed my own colleagues do thousands of lumbar punctures. I've seen students literally do lumbar punctures, especially those who are in their final year. Of course, students do these lumbar punctures under supervision. Very successful. I have seen junior doctors, someone who's flying above our head. Okay, there's a plane flying over our heads, so that's the noise. I thought we wait for it to go. I have both observed and supervised junior doctors doing lumbar punctures. And the point I'm trying to tell you is that a lumbar puncture is a very simple procedure. Even a doctor who has graduated today can actually do a lumbar puncture very successfully. But how come, why is it that such a simple and straightforward procedure breeds, or rather brings, feelings of anxiety and fear in some people? Why is that? Part of the reason is probably ourselves as health workers. We maybe don't explain things clearly. The other reason could be that when people come to the hospital and they actually do need a lumbar puncture, they come with very serious illnesses. I'll give you one example of a disease which is very dangerous and kills people very, very quickly. And to treat it, you need a lumbar puncture. And this is meningitis. So when somebody comes with meningitis, which is an infection of the brain, remember that the brain is a very, very sensitive organ. Any changes to either the surrounding areas in the brain or to the brain itself, the outcomes are usually very, very dramatic, including death. Now, when you are here that your relative has meningitis, I need you to understand that meningitis is an emergency. Meningitis is an emergency. If you don't do anything about meningitis, the patient will 99.9% of the time die. Okay? If you don't do anything about meningitis, 99.9% of the time, the patient will die. Now, here's the point. Sometimes, because people have come late to the hospital, or because they've been refusing lumbar puncture, and then finally they agree, and the lumbar puncture is done on a patient who is very sick, and this is a disease condition which actually kills people. Usually you will find that in human psyche or human observation, two things that happen together, usually one is thought to cause the other. But if lumbar puncture actually kills people, why is it that it is people with meningitis who die? Have you ever observed that? And yet, lumbar puncture is done also in mothers who are going for their cesarean section. Remember, if you ever did a cesarean section where you were awake, they were even talking to you, they just numbed you from the waist downwards. Just know that they pricked you right there where we put lumbar puncture. How come you don't hear those things in that space? So meaning that we need to really, really interrogate this issue properly. Okay? If a lumbar puncture is as dangerous as the way we want to make it, why is it that when it is done on pregnant women, they all survive? No one dies of a lumbar puncture for those who are pregnant who've had the cesarean section. There are some of you who are watching me right now. You know what I'm talking about. They pricked you right there where we prick for lumbar puncture. And they did the same thing to you during your cesarean section, especially that type where you were awake. How come you don't hear those things in that area if the lumbar puncture is that dangerous? How come? And yet, if you ask, just check. For most people who say lumbar puncture is dangerous, it kills people, ask them this question. What was the disease that your patient had? You will find 99.9% of the time, the patient also had meningitis. Now, meningitis is dangerous. With or without a lumbar puncture, meningitis is dangerous. Now, let's make something very clear here. When a lumbar puncture is done, the procedure has safety measures and steps that the health workers need to follow. Yes, if some of those steps are not followed, the lumbar puncture itself can actually be a problem. But those are very rare circumstances. The majority of the time, it is because of the disease itself. Because the volume of fluid that the doctors remove for them to be able to make a diagnosis on your patient is too small to cause the type of damage that is required for a lumbar puncture to kill someone. That's the other thing that I need you to understand. The amount of fluid that the doctors will remove when they are doing a lumbar puncture on you is too small for it to cause the type of damage that is required for a lumbar puncture to kill someone. Way too small. That's the other argument that you need to consider. So I need you to think back. For those of you who say, no, lumbar puncture killed your relatives, I need you to really, really think back. Go back. What was the disease that was being treated? If it is meningitis, why is it so easy for you to excuse meningitis as the cause of death and you want to accuse a lumbar puncture? Why is it so easy? Is it because that it's a lot easier to blame another human being than to blame the disease process? Because I can tell you for free that meningitis is extremely, extremely dangerous. Compared to a lumbar puncture, meningitis is more likely to kill your patient than a lumbar puncture can. There are some of you here who are listening to us, who are listening to this broadcast right now. You've done those cesarean sections and you've had lumbar punctures done on you. And yet you're still here. And we know a lot of you actually. And when you see people saying lumbar puncture kills people, you keep quiet instead of correcting them. Correct the impression. Tell them, when I was doing my cesarean section in Evananila Sapamsana, and I came out nice, I was okay. Tell them. Because if lumbar puncture actually kills, we should be hearing that, when women go for these cesarean sections where they inject you on the back, they don't come out. Why don't we hear that? Now, let's talk about why lumbar puncture is done and how it is done. Lumbar puncture is done because here are the reasons why it is done. The first reason we do a lumbar puncture, we do it because we want to know what disease process you have in your brain. That's the first reason. And I'll come back to this point because I need you to understand this point very clearly. The second reason we do lumbar puncture is if we are going to administer drugs. There's certain types of chemotherapy that we administer. We administer that chemotherapy through the same region of the lumbar area. There's certain medicines that we need to administer, especially when people are trying to do, those procedures where they don't want you to sleep around your waist going downwards. They might want to inject some drugs there. Like I mentioned, Nkanya cesarean section. The third reason we do lumbar puncture is for treatment. There are certain disease conditions that increase what we call the pressure in the brain. Okay, your CSF pressure, the cerebrospinal fluid pressure. So there are certain disease conditions that increase that pressure where the fluid itself, okay, remember that your brain is suspended in fluid, in water. That water itself can very quickly accumulate, especially if there's a blockage somewhere. And sometimes to relieve that pressure, as part of treatment, we do lumbar punctures to remove that water. Now, when lumbar puncture is being given as a treatment, that one needs to be done by a very experienced person who knows what they are doing. Because the volume that we remove When we are giving you lumbar puncture as a treatment, the volumes are big, meaning that we have to measure your pressure and then also, manage as we are removing. We could use the word titrating. So we titrate the volume we are removing against the pressure in your brain. Now, that requires someone who knows what they are doing. It requires a lot of technique and procedures. It's a very delicate process. But an ordinary lumbar puncture, where we want to know the disease that you have, is a very safe and simple procedure. Even a doctor who's graduated today can actually do it very safely. It doesn't require too much experience. It just requires a doctor who's been properly trained to do it, and most of them do it very well. Now, why do we do a lumbar puncture? Why don't we take a blood sample when we are checking for disease in your brain? Why don't we take a blood sample? Shouldn't it be easy to just draw blood and go and test blood in the lab? Why should we do a lumbar puncture? Now, this is what you need to understand. Your brain, the reason you're not even able to feel the weight of your brain over your shoulder is because it is suspended in water. Have you noticed how easy it is to lift a heavy object underwater? It's the same principle about your brain. Your brain is quite heavy, by the way. But because it is suspended in water, you don't feel its weight. Now, that water around in which the brain is suspended or bathes, that's the water which is also your body uses to nourish the brain, to also remove impurities from the brain. Okay? Now, there's a very important structure in your head called the blood-brain barrier, where your blood, does not easily mix with the brain material. That is why there's an argument that your immune system, as far as it is concerned, your brain does not exist. If your immune system were exposed to your brain, it will treat it like a bacteria and kill it. Okay? So how does the brain prevent itself from diseases? That is why when there's an infection in the brain, the immune system is not very efficient in sorting out that infection. Because of that same blood-brain barrier, the access of the immune cells to any disease that has crossed and is affecting your brain, the immune system finds it very difficult to move from the side where you have blood into the side where your brain is. And as a result, your doctors are racing against time. It becomes a bit of a challenge. That's just the way we were made. That's how we were created. It's our design. Now, because of that, it becomes very difficult for your doctor to accurately predict what infection you have in your brain if you have meningitis, if they got blood. Why? Because that blood is not in direct mixing and contact with your brain. And even where the infection is sitting, the blood has no access to that area because of this same thing called the blood-brain barrier. That is why your doctors always insist on doing a lumbar puncture. Now, the lumbar puncture is a lot more accurate, a lot quicker to be able to distinguish what type of infection you have. Now, someone asked me, Doc, then why don't you just give us the drugs? You've treated so many types of meningitis before. Just give the drugs. Now, here's the problem that you have. Most types of meningitis are quite similar in the way they present. And one of the most efficient ways you can distinguish them is if you did a lumbar puncture. Because you have bacterial meningitis. You also have fungal meningitis, where you have a fungus growing. Now, if someone has a fungal meningitis, you cannot give them an antibiotic. It won't work. The disease will kill them. If someone has a bacterial meningitis, you can't give them an antifungal. Okay, the bacterial meningitis will still kill them. You understand? So if someone has meningoencephalitis, which is usually a viral infection, where the virus is causing both meningitis and infection of the brain substance itself. That's why we call it meningoencephalitis. You can't give them an antibiotic, you can't give them an antifungal. So you're stuck. Now, the reason you are stuck is because the disease conditions, any disease condition that infects the brain is extremely dangerous, and you're racing against time. Time is not on your side. And that's why you need to be able to distinguish, is this a virus? Is this a bacteria? Is this a virus? Is this a fungus? So that you can choose the correct drug. Usually, here's the silver lining. Here's the silver lining. What is nice about brain infections is that once they identify the infection and they put you on the correct treatment, you will find that even recovery is quick. But if you delay, which usually happens, most people, because you delay, you are still dilly-dallying, you are waiting for the uncle to come from the village, you are waiting for the grandmother to the patient to come and make a decision on whether a lumbar puncture should be done or not. While you are waiting and dilly-dallying, the disease is not waiting for you. Bear that in mind. While you are waiting and dilly-dallying, the disease is not waiting. That's why you find that if you've seen where lumbar puncture is done after you have delayed, it doesn't really help much. Yes, in some cases, people recover, okay? It's not a completely useless procedure, even if the disease has advanced, but it's just that you are reducing the chances of survival of the patient. So next time you are in a hospital, next time your relatives is in a hospital, next time either your child or somebody you know is in a hospital, and the doctors are telling you we want to do a lumbar puncture, act fast. Act fast. Because your delay is contributing to complications in the patient. Your delay is contributing to poor outcomes in the patient. Very poor outcomes, actually. And I'm sure you have noticed. Some of you have experienced this. I'm sure you've noticed. So, let me see if we have questions on lumbar puncture. Please ask questions on lumbar puncture. Today, I'll take your questions on lumbar puncture. Only lumbar puncture today, lumbar puncture chat. Because we need to finish this subject. And on this subject, when we are done talking today, we need you to share this video, but also the knowledge you have acquired, spread it. Go out there and spread the knowledge, you yourselves. Tell people that lumbar puncture is safe. Because people die unnecessarily. Why? Because relatives, they will sit there and wait and wait and wait. No, it's not very that hey, we heard that they died. Who did you see? They don't know. No, we heard from someone. Question. Royce Chitembo Mumba. My late nephew had 11 lumbar punctures in 1 year. Okay. My own experience, I have done the highest number of lumbar punctures I did in one patient over a period of 21 days, in fact, 18 days, was 14. I did 14 lumbar punctures in one patient over a period of 18 days, and he survived. When I was still working in the government at that time, this guy used to work in Solwezi at one of the mines. He would always remember to send me beans every month. He survived. And I ate beans that year. So, now, that lumbar puncture, you do it, the one that I'm talking about where you do several lumbar punctures to manage pressure is very delicate. But again, what I'm trying to show you is that lumbar puncture is just a tool, it's just a procedure, and we use it under different circumstances. Okay. There's a question here, Tiba. What part of the body does the lumbar fluid extraction? Okay, where do we remove it from? Okay, fine. Remember that your back, your spine has regions in medical language. The spine around your neck is called cervical spine in medical language. And then your spine around your chest is called thoracic. And then around your belly or around your tummy, but your spine around the tummy area and the lower back, okay, is called lumbar. So there's a specific area where we go and extract the fluid, because that area, the spinal cord does not drop up to that area. There's no spinal cord there when we are pushing. So there's a specific area where lumbar puncture must be done, above which, if you push a needle, you go straight into someone's spinal cord and you paralyze their legs. Okay? So there's an area where, the anatomy of the composition of the human body is such that in that particular region, there is no spinal cord. Even if you push a needle there, you're not going to hit the spinal cord. Okay? So there's a specific safe zone where lumbar puncture must be done. And anyone who is trained knows that. And most of these doctors, they know that. They know that. Okay. What's the issue here? I don't know if they all delayed, but 99.8% of this procedure seems to end in tears. This is not true. This statement right here, Betha Milimo, is the reason I am going live today. This statement is not correct, and there are no statistics to back it. If you want, I can take you with permission to any of these hospitals and we observe lumbar punctures together and see who's going to die. This statement right here, Betha, is not correct. I have personally done more than 1,000 lumbar punctures. Let me tell you how a lumbar puncture kills people. Maybe that's how people may understand. If indeed a lumbar puncture were to kill you, here's how it would do it. First of all, the one doing the lumbar puncture must have removed a very large volume of fluid at the same time. And having removed a large volume of fluid, your brain would sag. It would like fall into a tiny hole at the base of your scalp. Once it falls into that tiny hole, a tiny hole at the base of your scalp, now the problem is that the portion of the brain that controls breathing would get trapped and squeezed. In medical language, we call that coning. And what would happen is that because that part of the brain controls breathing, you would switch off like someone has switched off a button and you'd stop breathing almost immediately. Now, if I were to ask you, Betha, because you said 99.8% of the people you have seen, this procedure kills them. How long did it take after the procedure did the patients die, the ones that you have observed? Was it immediately after the procedure? And what was the mechanism of death? You see, when we start asking you such questions, you will soon realize that probably you got this wrong. Most people will tell you they do a lumbar puncture right now, and the patient dies the next day, and you still want to blame the lumbar puncture for that? Or the patient dies after hours, and then they forget that the patient they were treating was extremely sick. And the reason is that in most cases, you delayed to agree to do a lumbar puncture. And then you also forget, and that's why I'm doing this podcast today. Do not forget that meningitis is extremely, I don't know how to emphasize this. Meningitis is extremely, extremely dangerous. Now, Betha, if your statement was correct, then every woman who has done cesarean section where your eyes are open, you can even see what they are doing. How come 99.9% of those women don't die? How come? Have you ever reflected on that? If this statement here is true, why is it that the women who do these cesarean sections where their eyes are open, they're only paralyzed from the waist going downwards. Why don't you hear that 99.8% of women who undergo that procedure die? How come? And yet it's done every day in these rural areas. And women go home and they nurse their children. These are the misconceptions we need to address in our communities. These are the rumors we need to confront in our communities. And Betha, I hope after this explanation, you will also be able to go out and correct this same misconception. Because you know what this has done? This very rumor is actually killing people. And you know how this rumor is killing people? Because people are afraid of lumbar puncture. They're either refusing or delaying lumbar puncture. People who could have ordinarily have been saved are actually dying. And it's unfortunate that in 2021, okay, in 2021, we are still discussing this subject matter. This issue should have died by now. But it's still there. Okay? This issue is still there. And it's causing problems, serious problems. There are a lot of funerals that are happening out there. Why? Because of this same misconception. Serious funerals. Let me address this one. Victoria Molat, does it mean even mothers go through lumbar puncture before cesarean section? Now let me explain this. There are two types of cesarean sections. There's that one where they put you to sleep completely. There's no lumbar puncture there. There's that one where you are awake. There are mothers here, please help me explain this because you've gone through this. You are awake. They've only paralyzed you from the waist going downwards. Okay? They inject drugs right there where we do lumbar puncture. Have you seen the difference? I hope you have understood. Okay, there's one here. Nelly Mumba Mlenga, why do people die if it's safe? My older sister died a few hours after the lumbar puncture. Yes. The key word in what you have said, Nelly, is a few hours. When the center that controls breathing is squeezed because someone has removed a large volume of fluid from the after lumbar puncture, the mechanism of death, madam, is very dramatic. It's almost immediate. It's like you've been switched off. Now, Nelly, I know that you're talking about your sister. It's a very sad conversation to have, but you left out key information here. You've not told us what disease your sister had. You haven't. Okay? You haven't. If your sister had meningitis, I can bet that it was the cause. Meningitis was the cause. And also there's something you've said in your statement where you've said your patient died hours after the procedure. That's not how meningitis does it. Meningitis, that's not how lumbar puncture does it. I wish I had models to show you what happens when if it were a lumbar puncture. And the other issue I needed you to understand, I don't know how long you joined this. I don't know whether you joined late or now or later. The volume of fluid that they remove when they're doing a lumbar puncture is too small to kill a person. It's too small. The volume of fluid that is required to be removed to actually cause death is much bigger than what the doctors remove when they're trying to do a diagnosis. Much bigger. So, in this scenario, while I sympathize with you and the loss of your sister, it would have really helped us if you said what disease condition your sister had. It would really have helped us. And it would have helped us For how long was your sister sick before the lumbar puncture was done? For how long was your patient sick before the lumbar puncture was done? Those are some of the things we need to process when we are looking at this information. Those are the questions we need to ask ourselves. All right? So reflect on those questions, and if you still feel that the questions that we are putting forward are not helping, you can always come back, but also give us more information so that we're able to assist. Okay, Mwelwa Malunga. Okay, I didn't read this question prior. What's your question? I'm in first year of medical school and it feels good to understand what you are talking about. Okay, no, thank you. All right, let's get questions, guys, on lumbar puncture. Don't feel shy, please ask. Yes. Now, this is Kathy Munongo Mwansa. I've done 2 cesarean sections. They had to put epidural catheters on both cases. Now, I understand this, huh? Basically, what she's telling you is that when she did the 2 cesarean sections she did, they also did something to her that is like a lumbar puncture. And she's here. She has lived to tell the story. You know why? She didn't have meningitis. Okay? It was just a pregnancy. And if lumbar puncture does kill people, this woman here would not have lived to come and write this statement. She wouldn't have lived. If it is true that lumbar puncture kills people, this lady here should not have lived to come and write this statement. She had 2 of them in both her pregnancies. So please, we beg, if there's something you are not clear about a lumbar puncture, here's what you should be doing. When a doctor comes to you and says, "Madam, we want to do a lumbar puncture on your patient," okay, that's the right time for you to start asking them questions. Let the doctor tell you, how is the procedure done? Okay, this is what you should do next time. Next time, you have a relative who needs to do a lumbar puncture. Okay? Next time, Evaristo, we talked about the indications for lumbar puncture. I don't know what time you joined us. We are happy to repeat. Next time, you have a doctor telling you we need to do a lumbar puncture on your patient. Here's what you should do. First of all, ask the doctor, tell me how this procedure is done. And then the doctor will explain. The next question you should ask the doctor, why do you think my patient needs a lumbar puncture? Okay? Then the doctor will tell you. Then you ask, then when you do this lumbar puncture, what is it for? What are we looking for? What's the end? What's the purpose? And then the 4th question you should ask your doctor, if they suggest a lumbar puncture on your patient, is to say, "Doctor, what are the risks?" So the doctor is supposed to explain to you the risks. Now, once they explain to you the risks, they're supposed to also tell you the likelihood of that risk happening in your patient. And then your doctor will then weigh the risk of the lumbar puncture plus the risk of doing the lumbar puncture compared to the risk of not doing the lumbar puncture. The risk of not doing a lumbar puncture in a patient who has meningitis is much, much higher than the risk of doing it. By far. By far. If you are doing a risk-benefit analysis, when your doctor finishes telling you the risks of doing a lumbar puncture, which there are a few, okay? Let them also tell you the risk of not doing a lumbar puncture. Doctor, what is the risk if we don't do a lumbar puncture? And then weigh. That's how you interact with doctors. I know in some public institutions, doctors may be busy because they have a lot of patients around, whatever. But, you know, if lumbar puncture is that important to you, if it scares you, then it means that it's important to have these conversations. But let me assure you that a lumbar puncture is safe. The lumbar puncture can be done in a sitting position or in a lying down position that we call the fetal position. It can be done. Okay, let's see. What are the other questions? This issue of lumbar puncture, I hope today we have exhausted it because it keeps coming back. Huh? This is interesting. This is Collins Siamambo. Doc, I'm glad you are shedding more light on this subject matter. I'm actually a survivor. I had it this year in June when I was diagnosed with meningitis. All right. There you go. Someone who had a lumbar puncture this year itself, they had meningitis and they survived and they are here to tell the story. If this man and his relatives had refused to do a lumbar puncture, my guess is that we wouldn't be talking, or he wouldn't be here talking to us today, most likely. And also, I can guess that in your case, Collins, you made the decision early to do a lumbar puncture. Usually when people delay to do the lumbar puncture and they come and do it at the last minute, someone has, now meningitis has really hammered someone. That's when you want to come and do a lumbar puncture. And then after they do lumbar puncture, meningitis kills the patient. And then you start saying, those doctors have killed my patient because they did the lumbar puncture. But you forget. Ladies and gentlemen, I cannot overemphasize this enough. I cannot emphasize this enough. Meningitis is extremely, extremely dangerous, more dangerous than the lumbar puncture that you keep accusing of things it doesn't even do. Spend time in these hospitals. You see, you may have seen 3, 4, 5 patients with meningitis. We've seen thousands. We've saved some and we've lost some. Okay? But one thing we will tell you is that one of the things we have observed that is giving us very poor outcomes when it comes to treating treating meningitis is because relatives and patients in some cases resist to do this very important diagnostic procedure. And as a result, you delay treatment. And because you're delaying treatment, that's how come we're ending up with these types of outcomes that we have. Does it mean every patient who has meningitis, once they do lumbar puncture, they'll survive? No. It simply means that you are improving their chances of survival. Does it mean that every patient who has meningitis and they don't do a lumbar puncture will die? Most likely. If they don't do a lumbar puncture, your patient will most likely die. Can they survive? It's possible. Some have survived. Let's not exaggerate things here. Some have survived. But chances of death are much higher. If a patient has meningitis and you don't do a lumbar puncture, chances of dying are much, much higher. A lot higher than you can imagine. Okay. So, ladies and gentlemen, what we do today, share this video. Okay? Share this video as widely as you can. On your platforms, in your churches, in your homes. Let as many people as possible watch this video because you see, you are saving lives. With this knowledge going out there, you're saving lives. Let's stop hearing this business where a patient has meningitis and people are dilly-dallying to do a lumbar puncture. They're still waiting for his uncle to come from a very far-flung village somewhere to come and make a decision. Let's not do that to ourselves. Let us not do that to ourselves. We have enough problems already as a country as we speak. Okay? Let this lumbar puncture issue, let's remove it from our list of problems. And you who is sat through this broadcast, you who are sat here listening to this, you are part of the solution. Go out there and share what you have learned and dispel these rumors, dispel these misconceptions. Okay? And let people watch this video. And if there'll be more questions in the future, come and ask us. All right. So this has been Dr. Mjajati. If there's a point you missed, I've seen a number of questions are asking questions that we have already discussed earlier on. At your own time, play this video over again and, see and pick out what you may have missed. But above all, share this video, share it, share it, share it. We can't emphasize that enough. For healthy and prosperous citizens, this has been Dr. Mjajati discussing lumbar puncture, and would like to thank CarePick Specialist Clinic for the sponsorship. Do take care and enjoy the rest of your weekend.